Hey everyone, I generally publish 3 episodes a month, but I want to share this bonus 4th episode with you, as I know there will be a lot of people embarking on road trips in the coming days. As such, I've chosen one of my earliest interviews to re-release, and it's my first interview with Dr. Pat Friman, who, as many of you know, went on to appear in several more Behavioral Observations episodes. I've left my opening monologue intact from that recording, so the 2022 version of me won't repeat what the 2016 version of me had to say about what was covered in this episode. What I will say, though, is that if you're listening to this re-release of Session 10 shortly after it's published, there is a huge CEU sale going on right now. So if you want to learn more about that, go to behavioralobservations.com and click the Get CEUs button. And you'll be able to see the huge discounts that are available now through November 27th, 2022. And if you're catching the show after this sale is over, don't worry. I usually have a few different discounts going on at any particular point in time. So it's worth checking out no matter when you hear this particular episode. And speaking of Pat Friman, 3 of his later appearances on the show are indeed eligible for CEU. So if you enjoy what Pat has to say and the way he says it, and you want to hear more and earn CEUs along the way, then this sounds like a win-win. So again, head on over to behavioralobservations.com/get CEUs, and all the information will be there. So with that having been said, I hope you enjoyed this re-release of Session 10 that was originally published, I think, way back in August of 2016. So again, without any further delay, here it is. This is the Behavioral Observations Podcast with Matt Sikoria, session number 10.
Welcome to the Behavioral Observations Podcast, stimulating talk for today's behavior analysts. Now here's your host, Matt Sikoria.
Hey everyone, it's Matt Sikoria coming back at you in session 10 of the Behavioral Observations Podcast. It is my distinct honor to share with you this conversation I had with none other than Dr. Pat Friman. Pat is the Vice President of Behavioral Health Services at Boys Town, and we get into what Boys Town really is and how it started and things like that later on in our discussion. And he's also a clinical professor in the Department of Pediatrics at the University of Nebraska School of Medicine. Pat has had a long career in behavior analysis, and he's published more than 180 articles and chapters, primarily in the area of behavioral pediatrics, and he's well known for interventions for common parenting issues such as bedtime problems and thumb sucking. One of his interventions, the bedtime pass, won him quite a bit of notoriety, as a matter of fact. So he is well known for being a great ambassador for behavior analysis. In other words, using it in areas that are less well established. For example, again, using behavioral pediatrics as one area to disseminate the practice. So he's also a wonderful speaker. I know many of you have seen him present, and I've had the opportunity to do that as well. And he is just a masterful presenter. And that kind of comes through in our conversation today. In our conversation, we talk about how he got into behavior analysis, his, shall we say, unique point of view on functional assessment practices, how he interviews parents, his take on how adolescents and adults communicate with technology, and he also takes a few minutes to talk about the remarkable story of how Boys Town got started. It is a story you don't want to miss. We also talk about some of my struggles with parenting, and that wasn't by design. For some reason, we just kind of stumbled upon that, and so you'll get some entertainment at the host's expense. So you're welcome. That part of the interview came when we were talking about behavior analysts as parents and how behavior analysts have the same types of struggles that everyone else does, including things like depression, anxiety, marital issues, etc. So, and what that does essentially is it kind of tees up a second interview that I conducted with Pat that I'll release in a few weeks about mental health issues in general. But for the purposes of this interview, we we had a little bit of fun at my expense, and I hope you get a few laughs out of it. One other thing I'd like to draw your attention to is just how Pat communicates. I've been on this kind of storytelling kick for a while, and if you'll notice about how he describes how he got into behavior analysis and the story of Boys Town and things like that, Pat communicates in stories, which I think makes what he has to say way more memorable. And without any further ado, please enjoy this episode with Dr. Pat Friman. Hey, Pat Friman, how are you doing today?
I'm doing fine, Matt.
Thanks so much for joining us here today on the podcast. There's so many things I want to talk to you about, and I'm going to do my best to keep it narrowed down to a couple of topics. I do want to start with one particular area that I'm just interested in generally whenever I speak to another behavior analyst. And what I want to know is if you could tell us kind of how you got into psychology, behavior analysis, and so forth. Would you mind spending a few minutes and giving us kind of the Pat Friman backstory?
Sure. I'm from Montana. Land where men are men and so are the women. So it's like rugged, rough country, and I grew up hard. And I got interested in psychology partly because of classes that I took that were relatively easy. I mean, I had friends in college who were taking real classes like in chemistry and physics and calculus, and by comparison, psychology was pretty easy and actually very, very interesting. And so that perked my interest. And then I went sideways in a relationship with a woman and left the town where I was going to school, Missoula. I went to a small town in Montana called Boulder, where they had Boulder River School and Hospital, which was an institution at the time for what they called the mentally retarded. It was an acceptable term at that time. Mm-hmm. Then became developmental disabilities. It was very large, one of those old warehousing institutions, and I got a job as a direct care aide. And I was told while I was in pre-service there to not go anywhere on campus and don't go into the cottages, and if I did do that, I'd get fired. And I'm walking to the educational classroom one morning, and a nurse crosses my path, and I swear to this day that she winked at me, but if you were to ask her, she would say she didn't, because she always said she didn't, but I swear she did. As a function of that, I followed her into one of the cottages, and she disappeared, but as soon as I got there, it was a cottage that was housing adult, high-functioning men, and there was a huge brouhaha that occurred right in the vestibule where I'd come into the building because I was a stranger, and that was always an exciting event for them. And the director of the cottage burst out of his office, which is right there, to find out what was going on, and he asked me what I was doing in his building. And simultaneously, I saw two things. One was an advertisement for a training officer on his door, Facilitation Aid 5 is what it was called. And the other was a life-size poster of Alan Page, who was defensive genius for the Minnesota Vikings at the time. And so I told him I was there to apply for that job.
On the spot? You just...
On the spot. And that job required a master's degree in psychology, and I didn't even have a bachelor's degree yet. So he said that the time wasn't right for interviews, but since I was there, why not come in? And so we sat down and talked about the Minnesota Vikings for an hour, and for about 2 minutes about psychology and my suitability as a training officer. As a function of that conversation, he liked me. He said that if I would complete my degree, he'd cut some tape for me and allow a bachelor's degree to be suitable criteria. And I just needed one more course. So I got French credit for my 3 outstanding credits, which were incomplete. Got the job as a Facilitation Aid 5 and joined the ranks of 7 other behavior analysts. I didn't know what a behavior analyst was at the time. And my job was to write programs, behavior modification programs that were designed to get behavioral excesses down, behavioral deficits up, so that the men in that cottage could go out into the community for community placement. Mm-hmm. And the first couple of programs I wrote worked pretty well. I wrote up little articles about them for what was called the Boulder Behaviorist, which is a little newsletter put out by Boulder. And on the strength of those little papers, I got another job in Missoula, and on the strength of that job, I got into the University of Kansas. And there's some bunch of stuff in between, but that's basically how it started. It was started as a sham.
A serendipitous one at that, I reckon. When you say when you said you were working with other behavior analysts, did they? What did they call themselves at the time? Was the term behavior analysis in vogue? We've obviously seen an evolution of what we call ourselves and so forth.
That wasn't common then. They like a couple of the people that had the jobs had come from Carbondale, Illinois, Southern Illinois, and worked under Nate Asrin, and their degrees were in behavior modification, a master's degree in behavior modification. So they were either behavior therapists or behavior modifiers. They all had master's degree. One of them had a doctoral degree. They had all done their research on behavior analytic topics. And the title of their position was Habilitation Aid 5, but that was basically a training officer. The job was for people that knew how to modify behavior to come in and modify the behavior of persons in the institution so they could move out into the community. That was going on all across the country. That was part of what was called normalization at the time.
And about what time period was it? No, I don't want to date you or anything like that, but about what era, if you will, was this?
I got the job in 1975.
Okay.
And that batch of programming lasted for 5 or 6 years. And Boulder River School and Hospital was prominent for a couple of reasons. There was a woman there, maybe I shouldn't name her even though she's deceased now, but there was a young woman there who was dangerously self-injurious. And she was only mildly disabled, but she was in 4-point restraints 24/7 for a couple of years. She was only taken under restraints for bathroom breaks and feeding. Mm-hmm. They first brought in Richard Fox, who did a program involving electric shock and got this young woman's behavior down to 0 levels.
Okay.
Caused controversy with the state legislature, and so they eliminated the program, put her back in restraints. Then they brought in Brian Iwata, who did the same thing and got the same result. But again, it caused controversy because it became public knowledge that electric shock was being used to eliminate this girl's really unfortunate self-injurious behavior. Mm-hmm. And so they eliminated that program and put her back in restraints. But it sort of brought Boulder River School and Hospital into the public domain because a long story was written about her and about those programs in Reader's Digest. And I think for that reason, Boulder attracted behavior analysts, or what were then called behavior modifiers, to come and work there. So there were some really talented people working there. They just sort of one of those deals where you find the one that doesn't belong, and that would have been me. But I learned fast.
And so the idea of writing behavior plans, et cetera, was more or less, was that on-the-job training?
Yes, it was on-the-job training, but it wasn't that difficult. I'll give you just one quick example.
Yeah, sure.
I come into the cottage one morning, and there's a guy in there. I'm going to call him Jim, and he's a punch-out artist, this guy. He walks up and down the hallway, and whenever one of the other residents would engage in kind of mind-numbing stereotypy, so maybe standing and flapping, Jim would walk up and nail the guy with a roundhouse punch and just floor him. And I saw this happen. And what I also saw was what I think intuitively was behaviorally sensible to me. It wasn't a function of my education, it was just in my common sense. But the staff went to Jim, the punch-out guy, to see if everything was okay. And like one staff person went to the victim, 3 staff people go to Jim, they talk to him in soft tones of voice. Mm-hmm. Then they ask him what's bothering him, and he has a counselor, and he says something about his anxieties. He can't use full sentences. And then they take him down and put him in the staff lounge and get him a cup of coffee with some sugar in it. And the staff lounge is like the holy of holies in that institution. So there's the poor victim laid out, one staff person taking care of him. There's the aggressor surrounded by sympathetic staff people who take him into the staff lounge and give him coffee. And I thought, well, I can figure this out. And it was my job to take care of that program. So the following week, I got all the staff together and rearranged the program so that next time he hit somebody, everything was reversed. The staff would take care of the victim, and Jim became that victim's slave for a day. So he had to surrender all his candy to his victim. He had to go up and make his victim's bed. He had to sit next to his victim during breakfast, lunch, and dinner and give whatever was on his plate that the victim wanted to the victim. And that behavior was eliminated completely within like 8 days. And I had all the staff incident reports over a 2-year period, and then continued to take that as data. And it went from like 8 to 10 a week to 0 for over a year before I left.
Wow.
And the point I'm making here is it didn't take a rocket scientist to figure some of this stuff out.
Yeah, and as much as we like to make the distinction between behavior analysis and behavior modification, that intervention was, clearly effective. Now, did you? I don't know if you were looking at this at the time, and of course, we want to place this in its historical context. But if we could hypothesize that the function of that behavior was, some synthesis of attention and
it was clearly attention,
tangibles,
I would say the tangibles played a small part. It was clear to me at the time, without even knowing anything about functional analysis, that this kid Jim was doing this as a function of attention. He got attention from not just the staff, but from the other residents for his role or his reputation as this tough guy. He really wasn't that tough. He just fell into that category, and then the staff and the residents sort of played into, I want to call it its, not his hands. When I say its, what I mean is that pattern of behavior. And they were nourishing that pattern of behavior. And as soon as we starved it, it went away.
Did you see other, once this repertoire of aggressive behavior went away, did you see did other kind of social opportunities open up to this gentleman?
Sure. Oh, he was out of the institution 6 months later. That was the only thing keeping him there. He was a high-functioning kid. But he was considered to be dangerous, and he really was eager to please. He wanted to talk to staff every day. He always knew people's schedules. He would be waiting for them when they came to the door. He had some other friends that were, this crowd living in this cottage, they weren't friendly to each other necessarily, mm-hmm. But some of the higher functioning persons there, I call him a kid. He was probably 22. So he was an adult man. But he had friends on the staff. He had friends in the population. The only thing keeping him in that institution was the fact that people considered him dangerous. Once we had 6 months of data on his dangerousness, which showed that there wasn't anything, he was put into a community group home. So he did fine.
Okay. All right. Yeah. Like I said, I'm just trying to compare and contrast, kind of what we might refer to as a behavior modification intervention versus a behavior analytic one, where we would be very concerned with teaching replacement behaviors for attention seeking, et cetera. And it seemed like those more or less naturally developed because the occasion was set for them. Well,
I object to what has become a virtually religious conviction that prior to intervening for any behavior, we need to do a functional analysis. The functional analysis is fundamentally our MRI, and it's designed to answer questions that we can't answer another way. So you go to see a physician, you have a headache. The physician will ask you a series of questions designed to determine what the basis of your headache is. If those questions don't yield any useful information, then he goes to the next level, or she goes to the next level and orders a CAT scan or an MRI or some other diagnostic imaging or diagnostic procedure. But they don't go there immediately. They go there when they have an actual question. And we can do the same thing with behavior. We just ask a series of questions and we can get at function. So, for example, I have done a lot of research on thumb sucking. And I can just ask a couple of questions of a parent and determine whether or not it's automatically reinforced. For example, does your child ever suck their thumb or finger when they're alone? And the answer is virtually always yes. When else do they suck their thumbs? Well, they suck their thumbs when they're tired. They suck their thumbs when they're angry. They suck their thumbs when they're bored, and they suck their thumbs when they're watching TV. Well, just on the basis of that information, I can rule out tangibles, I can rule out avoidance, and I can rule out attention. So I don't need to do a functional analysis. However, periodically, like for example, the behaviors that Ted Carr and Brian Iwata first worked on are truly mysterious. We don't have any idea why it's happening. We have some hypotheses, and early on they proved to be wrong. So for example, people thought of self-injurious behavior as a function of attention seeking when it was quite the opposite. And that wouldn't have been revealed without a functional analysis. So that's a very expensive procedure. It isn't necessary for all forms of behavior. Sometimes, frequently, probably most of the time, you can divine what the function might be just by observing the person, observing the behavior, and asking a few questions.
I see. Now, do you see it as kind of like a dividing line in terms of the complexity of the behavior, the complexity of the situation that would make you decide whether or not to go with an interview versus a more complex analysis?
Potentially. I mean, complexity would be a factor. What would drive me to a functional analysis is an open question about what's going on. Mm-hmm. So I form my own hypotheses and then test them with interventions. The hypotheses are formed as a function of simple observation and a series of questions focused on the behavior. But if those observations and those questions don't lead me anywhere, or if my intervention derived from the hypothesis doesn't go anywhere, then I'll go to the next level. Pretty similar to medicine, really. Okay. You try to go with the least expensive and least labor-intensive route, and if successful, continue down that pathway, and if not, then you go for more rigorous testing. And I consider functional analysis to be very rigorous testing.
Sure. There's some interesting stuff coming out about, and some of the stuff has been around for a while as well, about doing functional analyses that are brief in scope and localized to a couple. In other words, it's kind of like a combination of, what it sounds like you do versus, the full 4 or 5 condition multi-element design that, Brian Iwata, made famous, if you will. Whereby you do an interview and you create a hypothesis of what's going on and just do kind of a control and test, and you can get a functional analysis accomplished within the span of sometimes even 20, 30 minutes or so.
Yeah, listen, I know Greg Hanley.
That's exactly where I'm going. Yeah.
I think was one of the first people to introduce that idea, but not the first, because those brief functional analyses were being developed years ago in Dave Wacker's shop.
Yeah, in Iowa. Yeah.
Yeah. I remember though, I did a colloquium at the University of Kansas, and Greg was on the faculty at the time, a junior member of the faculty, and I presented a series of studies, many of which involved interventions. The overall purpose of the presentation was to undermine the idea that there's a necessary underlying psychopathology for certain kinds of child behavior problems, like encopresis or enuresis or hair pulling. So that was the argument I was making, and one of the pieces of evidence people use to argue for underlying psychopathology is resistance to treatment. And I was showing that these behaviors weren't that difficult to treat, were highly responsive to behavioral interventions. And then when I got done, Greg asked me why I hadn't done a functional analysis. And I remember that very well, because he had come out of Brian Iwata's shop. I knew he would champion functional analysis. It gave me an opportunity to think about that question. And I pretty much gave him the same answer I just gave you. It was like, I would have done a functional analysis if I had a question, but I didn't. I had a pretty clear hypothesis about what was needed for each of the behaviors I was treating. It proceeded with treatment and was successful virtually every time. So a functional analysis would have been superfluous. I think his views on functional analysis have evolved since then, since that was 10, 15 years ago.
Mm-hmm. Okay, cool. It must have made for some interesting conversation between the presentations, I gather. Do you standardize that conversation with folks? Do you have kind of a standard assessment that you questionnaire or anything like that, or do you just kind of elicit or you develop your hypotheses through general conversations? In other words, do you have this kind of list of questions in your head and you just kind of run through them as you're talking with families? And
I do.
Okay.
You'd have a hard time spotting it when I'm doing it.
Mm-hmm.
Because my style is very conversational, very relaxed. It wouldn't even look like it was a formal psychologist-client relationship. It would look like an ordinary conversation between two adults. But what's embedded in that conversation is what's called a typical day interview. And I just start at bedtime and go around the clock. And I'm looking for all the points of interface between the parents and what they want the child to do, and the child and what they want the parent to do. And those points of conflict are the points where you're most likely to find patterns of behavior and patterns of environmental reactions to behavior that need to be modified. So, for example, bedtime is one of those. Usually you got two people involved, the parent and the child, and both want different things. The parent wants the child down. The child wants to be up. That's a point of conflict, so I examine that. Then I just go around the clock. Do they stay in bed all night? What's the morning routine like? What's the breakfast like? What's the ride to school like? Skip school and assess that later. And then what time do they come home from school? How's the ride home from school? What did they do with the time that they have between school and they're coming home from school and dinner? What's dinner like? And then after dinner, what's that whole routine like between dinner and bedtime? What do you use for discipline? How does the child react? Like that.
I see. So that seems to be, is that from your, kind of, clinical psychology training to do that type of interview without it looking like you're reading off a sheet with, 15 questions on it and scored on a scale and et cetera?
No, not at all.
Okay.
In fact, quite the opposite. There's lots of ways to learn, and one of the ways is to have people demonstrate how you don't want things to work. In other words, by negative example. And I would watch psychologists assessing their clients and think to myself that seems so formal and stilted. And it almost seems as if there's a one up and one down relationship. And there isn't any need, given the kinds of problems I work on, to have the person I'm working with feel like a, quotes, patient. And so my whole context and my whole approach to this is excuse me, is to normalize it as much as possible. Mm-hmm. And so I thought to myself, there's probably a better way to do this. And that better way, in my opinion, would be to normalize the conversation and have it be as matter of fact and as casual as possible, which puts a person at ease. And I feel like I'm much more likely to get good information that way than if I use a formalized, structured approach. Now, I could be wrong about that, but I've been doing it that way for 30 years.
Right. Is there one or two critical questions that you absolutely fit into this conversation? And in other words, I'm, as you're describing how this conversation might go, I guess there's, part of my learning history is thinking about, okay, well, what are those elements, and almost making a bullet list in my head, and probably going against exactly what you're just saying, but but what are the key elements, I guess, if to the extent to which you haven't already described some of them earlier?
I'd say there's four that seem pretty key to me. One is at bedtime. First I ask, what's the bedtime? And what I usually get in response is a theory. So right away I know there's trouble. So bear in mind, bedtime occurs every night. And so if the child is compliant with bedtime every night, then they're practicing being compliant with bedtime every night and getting better at being compliant with bedtime every night. But if what I get is a theory, I know they're not being compliant with bedtime every night, so the opposite's true. They're practicing being non-compliant with bedtime every night. And that level of non-compliance at bedtime will reverberate out throughout the day. And so that's my target. It's my initial target. And then I want to know how much of the morning routine is independent. Because the more independent the morning routine is, the more the child is practicing going through the motions of what the parent wants them to do in the morning when they're not at their best. And their ability to do that will reverberate out through their day. Conversely, if they're not very good at their morning routine, they're not independent, they're resistant or non-compliant, that too is going to reverberate out throughout their day. So those are two hot points. Then I want to know, what do the parents use for discipline? Usually what I get in response to that is a theory, what they'd like to use, and then I have to work a little harder to find out what they truly use. And it's almost always a version of yelling, which they're reluctant to talk about, and the takeaway, the universal takeaway.
Oh, yeah.
And by the time they show up in my office, they've pretty much taken everything away. And they're still not getting any compliance, so they're upset. And then the fourth thing isn't so much a question, it's more an observation. And that is, I want to know how they exhibit appreciation to their child. I want to know how they exhibit approval to their child. I want to know how often they acknowledge their child. I want to know how the good stuff in the kid's life is being delivered and how much of it is being delivered. So I'd say those four areas are pretty key for me. I mean, there's lots of other stuff, but if you were to pick out the most important features of what I'm asking, those are probably it.
I see. So you can kind of define in that process where the challenging behaviors occur.
Yeah.
The more or less the ratio of positive to negative interactions and so forth.
Yeah, that ratio is really important. I don't get to see it in real time very often, so I have to divine it from my questions.
Mm-hmm. Yeah, I noticed in one of your presentations that you referenced the 5-to-1 ratio, and I think you said something like it was developed by the researcher, the
John Gottman.
Yes, the couples researcher. Yeah. What's interesting, at least from my point of view, is that there's some behavioral folklore that I think gets handed down from time to time, and one of them is the kind of 4 or 5-to-1 ratio of positive to negative interactions, if you will. And so it was good to know there was some actual research behind it, because I've always wondered, okay, what is the empirical basis for that?
Yeah, well, his research, I mean, he has an abundant amount of research on marriages. We've done research using the ratio here on campus at Boys Town. We use a point card system here, mm-hmm. and they have a 4-to-1 requirement for every point find. The family teachers are supposed to find 4 point award interactions, and the campus, the Boys Town Home Campus program, uses my shop to address the needs of kids who look like they're going to be terminated from the program.
I see.
And that's not a good thing. This is like the kids that are in a residential care program, they're on an escalator, metaphorically speaking, and they step off the escalator and into a residential care program. If they succeed, then they get back on an escalator, and that one's going up into the world where you and I live. Mm-hmm. The one they got off of when they came to residential care was going down. Where is that going down to? That's going down to homelessness.
Right.
So if a kid fails in a residential care program, they go back on the escalator, but it's going down.
It's going in the wrong direction, yeah. Hey, you know what? Now that you've brought Boys Town up, it might be a good opportunity to, if you wouldn't mind describing what Boys Town is to folks who may not be familiar with it.
Yeah, sure. Boys Town is the best-known residential care program for out-of-home youth in the United States and possibly the world, and it catapulted into fame as a function of a movie called Boys Town, starring Spencer Tracy, who won an Academy Award for playing Father Flanagan, and Mickey Rooney, who played a troubled youth. And the people listening to this probably don't know the movie Boys Town, but I'll bet their parents do.
Mm-hmm.
And Father Flanagan was famous in his day, one of the best fundraisers, probably in the history of fundraising. Everybody that was anybody at the time, and this is in the 30s, 40s, and 50s, visited Boys Town. There are pictures on campus here of Babe Ruth, Hopalong Cassidy, presidents, actors, and actresses. So as a function of his PR skills, he developed this program into what it is today. But it started out as just 5 kids on the outskirts of Omaha, and there was a basic philosophy, which is very similar to Skinner's philosophy, just said in a more prosaic way. Father Flanagan said, after seeing the kinds of kids that were in Omaha at the time, there were a lot of out-of-home kids, orphaned kids, and they were, dirty and underfoot, and they were pickpockets and thieves, and they ran in packs. People thought of them as dangerous. People thought of them as bad kids. Father Flanagan said, as often as he could, there's no such thing as a bad boy. There's only bad environment, bad teaching, and bad modeling. In other words, bad circumstances. In other words, he was making the very case that B.F. Skinner made throughout his entire career. He just said it in a more artsy, craftsy way. And that's the philosophy of Boys Town now. Now we have a city. Boys Town is a city with its own zip code, its own fire station, police station, post office. Yeah, it's right in the center of Omaha. It used to be way out of town in Omaha. Now it's in the center of the city. So we're our own little city, but we're surrounded with another city called Omaha. There are several hundred kids living here, boys and girls. They live in homes with highly trained married couples who are their surrogate parents, and the entire campus is run on a point system. And this patch of ground, it's about a square mile, is the safest patch of ground in Omaha. But when you're on the campus at Boys Town, you're surrounded with more thugs and thieves and robbers and rapers and possible murderers than you would be anywhere else in the state of Nebraska, unless you visit our prison system. And yet we've got no walls, no fences, no locked doors, and no security guards. So the question would be, how can you achieve that level of safety with those kinds of kids without those protections in place? And the reason we're able to do that is because of our behavioral economy, because of the system that we've set up.
Amazing.
It's actually miraculous. Yeah. And so when kids are going to be expelled from the program, they'll send them over here for us to take a look at them. And one of the things that we've done in the past is identify the ratio that we were talking about earlier. Mm-hmm. And the intervention we've used with some success is just to identify what it is and double it. So if they come, or if their ratio is like 4-point awards to every point fine, then we just double that to 8. And it doesn't matter to us how the family teachers find the behavior to reward. Their assignment is just to double that ratio so that the kid is now getting twice as many point awards as point fines as he was or she was before they came to see us. And we've got a paper showing the utility of that approach and the success of that approach in, I think, the journal Behavior Modification that came out some years ago. And now it's just sort of standard practice.
Now, when you say point, do the points involve praise, or in other words, when you say double the ratio, is that just finding more things to use the common phrase, catch them being good at, or
exactly what it is, yeah. Which is, people are not good at this. Like, mm-hmm. To use a kind of dime store neurology, our wiring, our neurological wiring, isn't designed to find good things because they don't have survival value.
Right.
Our neurological wiring is designed to find bad things because they can hurt us, and so we're a lot more attuned to people's foibles than we are to their virtues. And so you sort of have to program people to look for good stuff. They overlook it, and sort of stems from what I call the miracle of the tucked-in shirt. So nobody really thinks to. In any school system in the United States, or any home in the United States, nobody really pays any attention to a tucked-in shirt. but everybody pays attention to shirts that aren't tucked in. Now, I don't know why one deserves more attention than the other when one is what we want and one is what we don't want. And the one we don't want gets all the attention. And I know it'd be funky to walk up to a kid every time you see a shirt tucked in and say, hey, good for you, you got your shirt tucked in. But every once in a while, it's probably a pretty good idea to give the kid an idea, to give the kid the sense that, you know, it pays off, it pleases people to do what you're supposed to do. In order to get them to have that message, though, we got every once in a while show them that's important to us. And so much appropriate behavior gets ignored in favor of inappropriate behavior. And I just, the idea of doubling that ratio is trying to correct for that. You know, catch them good more often.
Yeah, yeah. Well, I mean, of course, you're talking to an audience of behavior analysts, and it makes sense and things like that. But one question I did have is, there are some kids that I've seen in my practice who, you know, they might have some sort of, whether they're coded with or have a diagnosis of oppositional defiant disorder or something like that or not, or just, you know, have a history of challenging behaviors, noncompliance, etc. Some kids I've worked with actually react quite negatively to praise. So if you say, you know, nice job tucking your shirt in with your, you know, you look nice with your shirt tucked in, they would untuck it. You know, it's almost like that praise provides them, you know, the opportunity to engage in behaviors that have a history of attention, you know, as a reinforcer.
That's a form versus function problem. You'll get the same thing here on campus. It's the same thing is probably found everywhere. Like, you know, women like to be thought of as beautiful. Men like to be thought of as handsome. But you can't just walk up to a woman and say she's beautiful or walk up to a man and say he's handsome. The timing and the delivery of that comment is so important. The words aren't nearly as important as the timing and the delivery. And it's the same with these kids.
So what would be some essential tips for...
Let me give you two examples.
Okay, cool.
One would be from a brand new family teacher. And let's say the behavior they're working on is posture. And so the brand new family teacher comes up and goes, nice job, Johnny, you're standing very straight. I know you're working on posture, so why don't you give yourself 500 points? You know, Johnny's going to be, if his friends were anywhere nearby and heard that happen, he's going to be offended and probably start stooping, just so the family teacher won't do that again. But we've got some couples on campus that look like ordinary people when you see them, but they're actually magicians. I can think of one. His name is John Reel. If he was doing that interaction, he would go up to Johnny, take him off to the side, and go, you know, Johnny, I was watching you standing there. I looked at you and I just thought, man, you're standing so erect, and when you do that, you look strong. You look powerful. It's really impressive. Look, I know you're working on posture. Why don't you write yourself down for 500 points? And that goes right in, right to where Johnny lives. So it's really a function of how you deliver the information. So those kids that are resisting praise, well, it depends on the context of how that praise is delivered. They don't want to look to their friends like they're kowtowing to the man, so to speak, but they still want to get those points because they can use them. And all of us run on approval, appreciation, and admiration. Doesn't matter if we're oppositional defiant or we're as cooperative as anybody can imagine. Everybody runs on the same stuff, but the timing and the delivery of the stuff is critical.
That's a terrific example. I'll be sure to remember that one. Are there other aspects of Boys Town you want us to know about? It sounds like just a remarkable place.
Yeah, there's one part of it that's important. We work on social skills here. You know, so I run a big clinic at Boys Town, and the clinic that I run serves the community of Omaha more than it does the community of Boys Town. And we see 5,000 families a year. And our waiting room then is often full. But we also see Boys Town kids. So I run an APA-approved internship, and my interns provide counseling for the Boys Town kids. So at any given time in my waiting room, there are teenagers from the community of Omaha, and there are teenagers from the community of Boys Town. And the teenagers from the community of Boys Town are established as delinquents, dropouts, thugs, thieves. kids that have been in a lot of trouble. So you go into my waiting room and pick out which is which. There'll be one group of kids that sit up erect. They're well dressed. They don't have sagging and bagging. They're not wearing too much makeup. They make eye contact with adults. If you sustain the eye contact, they're likely to stand up and introduce themselves to you. Then there's another group of kids that are slouched, exuding attitude, maybe pierced and tattooed and wearing ragged clothing and exuding insolence, if anything else. And you'd think, those must be the Boys Town kids. And those would be the Omaha kids. And the kids sitting erect, making eye contact, those would be the Boys Town kids. Because we train our kids to exhibit certain kinds of social skills that work in social environments. I just had Jim Carr out here visiting, and he came up on campus, and I took him over to show him the field house. And my car was a brand new car. It's a really nice car. Was swarmed by a gang of teenagers from Boys Town that were just coming into the field house. And they were asking me if they could wash my car. But that's a Boys Town.
Amazing.
If that same group and that same car would have been in some inner city where these kids came from, the question they would be asking me would have been entirely different than, can I wash your car?
Yeah.
If you come here and you run into a group of teenagers, say 10 o'clock at night on one of our streets, they're coming towards you and you start to get nervous, what's going to happen is you're going to get surd. And if you look lost, you're going to get directions. So our social skills training program is transformative while the kids are on the campus. But once they go back to where they came from, if they do, a lot of those skills disappear. We know this.
Sure.
But there's also something that we give these kids that no street in no community can take away, because we have our own schools. And what we aim to do is give these kids a high school education. And there isn't any street anywhere that can take that away once they have it. So that's the kind of medicine we're trying to supply. Medicine we know that will probably wear off under certain circumstances, and medicine that we know will never wear off no matter what happens. So we're trying to do both.
Have you taken this model, for lack of a better term, on the road? Have other other satellite locations? Or have you done it in like a day context, perhaps in a different community, and so forth?
Yeah, yes to all those questions. There are how many? I think we have 9 other sites across the United States, and then the model of care that we have is called the teaching family model, which was derived from the experimental setting called Achievement Place, run by Montrose Wolf and Ellery Phillips. And that resulted in a teaching family association. And at any given time in the United States, there are 50 to 100 programs that use that technology. So it's been replicated widely. And there's a long series of systematic replications and systematic pieces of research in Java as well as other places showing what this model can do and what it has done. So yeah, it's pretty potent.
Cool. Well, that's just an amazing overview, and it sounds like you guys have just really impacted these kids' lives for the better. So I really appreciate you taking the time to kind of lay that out. I do want to ask you some questions about parenting. I know we kind of touched on that earlier, but I want to kind of circle back to that. Are there common what from your perspective are the most common parenting problems that you see when people come in to seek your counsel?
There's one that's central to just about all of them, and it involves the point of intervention that a parent selects, and they inevitably wait too long for discipline. So my overriding mantra is that when children are disciplined, they're the ones that are supposed to be upset. There isn't any need for the parent to be upset. And if the parent is upset, then usually it's because they waited too long to intervene and they're frustrated. So parents will issue an instruction of some sort in an ordinary tone of voice, and there isn't a more meaningless verbal utterance probably in our culture, because nobody ever follows up on that one. So for example, a parent will go, "John, would you pick up your toys, please?" And he doesn't do it. Right there should be an intervention. Just a brief little, say, timeout or withdrawal of a privilege or an opportunity for Johnny to pick up his toys before he can do anything else. But what happens instead is the instruction gets repeated in a slightly more firm, slightly louder tone of voice. And that pattern mounts until the parent has lost their patience, become extremely frustrated, and then they yell, then they threaten, and sometimes they corporally discipline. But all of that has nothing to do with the behavior. It has more to do with the frustration the parent experiences, because frustration is nothing other than the experience of the absence of options. And what they need to do is intervene more sooner and have far more options, have an abundance of options. So I don't like to, I mean, I've never met a parent that really thought highly of their yelling.
Mm-hmm.
And I've probably worked with 8,000 or 10,000 parents over the course of my career, and all of them, to varying degrees, are embarrassed about how much they yell.
Sure.
But they don't need to yell. If they intervened on the front end of the misbehavior, yelling would be unnecessary. The yelling occurs not as a function of kids having hearing problems, but as a function of the parent having let the behavior go on too long and become frustrated and lose their temper, and then they yell. So, like when I'm demonstrating to parents how I'd like them to proceed, and I'm giving the instructions to kids, I use a very soft tone of voice. Can you hear what I'm saying? Can you hear me now? I'm actually talking to you.
Okay. Yes, I can. Sorry, I thought.
Can you hear that?
Yeah.
They don't hear it. I mean, the kids, they hear it, but they don't attend to it because it's in that tone. And the next thing they know, they're in timeout. And then when they're out of timeout, I take them back to the same scenario, and I use exactly that same tone of voice, and this time they hear it. And from that point forward, whenever that guy's in the room, and that guy is me, everybody that's in that room is listening very carefully to what I have to say, because they know that that guy doesn't raise his voice. And if you don't pay attention to what he says, things could go badly very quickly. And all I'm trying to do is demonstrate to parents that they don't need all that drama. Like, when you get a speeding ticket, you know, the policeman could care less. He doesn't care about your driving habits. I mean, it's just a simple speeding ticket. He doesn't raise his voice or threaten you with like not being able to get into college or tell you you're never going to get a future. Just basically, or she basically will tell you what you did wrong, ask you for your stuff, write it down, check your stuff, give you back your stuff, and ask you to sign the ticket, tell you where you can get it disposed of, and then wish you a happy day. And what happens? What happens afterwards is the person that got the ticket signals to leave the shoulder of the highway. Nobody ever signals to leave the shoulder of a highway unless they've gotten a ticket, because they're signaling to the officer that they are such fantastic drivers.
Hey, I'm following the rules.
And then they drive away with their hands at 10 and 2, driving under the speed limit, like they just got out of driving school, and they drive like that for days. And why does that happen? Because they got a ticket from a dispassionate source. And the point is, the ticket does the work. The drama is absolutely unnecessary. And this is one of the fundamental things I'm trying to get across to every parent I've ever worked with, is let the consequence do the work and remain dispassionate as you administer it, and you'll feel better about what you're trying to accomplish. You'll be more inclined to use it more often because it won't make you feel bad, and the kid will learn way, way more, and they won't learn that they need to be afraid of you. So that's one of the central points of just about all I do, is intervene sooner and intervene dispassionately.
I see. Okay. When you talk about parenting, and particularly if you're talking to an audience where there are behavior analysts, present, if you will, if you're doing like a conference presentation or what have you, do you ever have behavior analysts or BCBA types come up to you and kind of whisper and hey, I kind of have this, in other words, I always kind of joke or sometimes you see something on the BCBA Facebook groups or something. Someone's talking about struggling with their own parenting and things like that. Do you ever have people come up to you who despite having a lot of training and so forth, say,
Everyone,
Pat, yeah, can you, and they're kind of perhaps trying to be whisper almost embarrassingly,
virtually everywhere I go.
no kidding.
I'll tell you something about behavior analysts. And when they get in trouble with their life, they don't go to a behavior analyst.
Go on.
Well, behavior analysts get depressed. Behavior analysts get divorced. Behavior analysts get anxious. Behavior analysts have trouble with their kids. Behavior analysts have trouble with their marriage. And when they encounter real trouble in any of those domains, they don't go to a behavior analyst for help. They're more inclined to go to a mainstream psychologist that has a reputation for being warm and accepting and insightful. And we're completely missing the boat on some very important areas of human experience. And the evidence of it is found in where do the behavior analysts go when they get into trouble, and they don't go to fellow behavior analysts. They don't want any of that push, pull, click, click stuff.
Really?
I don't.
Do you think that's just kind of how, at least in terms of the more recent focus on autism and treatment and things like that, that perhaps some more newly trained behavior analysts may be less apprised of the broader behavior therapy roots of the practice?
Well, I think that more senior members of the field actually have been disparaging of behavior therapy, behavior modification, interventions that are conducted without a functional analysis. And so the junior members of the field, the people that are in school, are just taking to heart what they are learning from their advisors. We have a very technical approach to human behavior, and we have a very technical language when we talk about human behavior, and it makes sense in certain environments and it doesn't make sense in other environments. For a lot of the kids, particularly kids on the spectrum or persons on the spectrum, that tightly tailored approach probably is very, very useful, especially on the front end. However, even it can be made more naturalistic. And I don't feel like the technical language that we use with each other is the right language to use with the consumers. It gives a non-human feel to the whole enterprise, and it terminates the conversation right there, because the consumer is not going to be able to tell their friends and family what they're doing with their kid, because their friends and family aren't going to understand the language. If the consumer is trained to talk about what's happening in clinic in ordinary terms, then they can talk about it with their friends and family, and their friends and family will understand. Mm-hmm. So, sort of an overly technical approach to human behavior that seems to fit when persons have disabilities. It doesn't fit so well when they don't, especially if they're adults. And my opinion is it can be made to fit everybody. Continue with the same concepts, the same principles, just deliver it differently and talk about it differently. I don't know, am I making sense here?
I think so, yeah. I mean, it just sounds like, how do we... Well, let me, I guess, answer your question with a question. I'm wondering if we as behavior analysts, for lack of a better word, this is pardon the kind of the mentalism inserted into this question, but overthink things. For example, if I guess I'm comparing and contrasting, kind of the way in which you would decelerate a behavioral event that you described a few minutes ago versus, for example, I have three children. I've got a 7, 9, and 11-year-old at the time of this recording, at least, and I'm thinking through, if there's a negative interaction between the siblings. My youngest is a master at getting my oldest to freak out over what we might otherwise describe as trivial things. And so I'm thinking function. I'm thinking, how do I get my oldest to not respond? And how do I've had conversations with her trying to explain to her, and not necessarily using the term extinction.
Yeah.
In other words, I guess not that I'm looking for parenting advice on the air here, but I just kind of comparing and contrasting. Am I thinking too hard, or and would that be kind of a metaphor for what you're trying to describe?
Actually, you just did an example of it when you proposed your question. You overthought using the term overthink.
Oh goodness.
You know what I'm saying?
Yeah, I do. Yeah.
You put a caveat in there about mentalism, when that's a perfectly acceptable way to talk about what's going on here is by thinking. Mm-hmm. But behavior analysts are so skittish about using terms they think even have a little whiff of mentalism to them. It stilts their entire approach to a conversation. So overthinking is a perfectly good way to talk about what you're talking about. I don't think it needs and doesn't need a caveat. And whether you're overthinking it, I don't know. Because what you're doing is what I was recommending earlier, and that is you're conducting your own hypothesis-driven assessment of what's going on with your kids and basically watching it and trying to figure out what it is without having to get in there and do, full-bore functional analysis.
Right.
You're doing your own kind of, what do they call that? I don't know. There's some term for the functional assessment that people do that's hypothesis-driven and not observation-driven.
An indirect or just combination of indirect and descriptive.
They're a descriptive one, yes. Maybe you're overthinking it. Doesn't sound like it.
Okay.
Although the problem that you sketched is not uncommon. Which one of the two kids is better behaved?
Oh, well, they have their moments, I guess, both of them. Probably I don't know. That's a tough one because they it's funny because our middle kid, not to kind of deflect the question, I'll get back to it in a second, but our middle guy, kind of gets almost like the image that's conjured is a guy with a bag of popcorn at the movies kind of watching the show.
Yeah. Middle kids learn that one. Yeah. I mean, they're sitting in the middle. They're sitting in a great spot to learn which way to go and how to stay out of the fray.
Oh, yeah, yeah. He's the most compliant one of the three, certainly cooperative or whatever.
I mean, we used to use the term white knight, black knight. Maybe that's freighted with unfortunate significance now. I don't know. I'm thinking of chess.
Sure.
And I'm thinking of cartoons. But the white knight's job was to make the black knight look bad any way they could. And so the way you could smoke out the white knight is by disciplining the black knight. And then the white knight starts doing appropriate things. Like you got one kid, you put him in timeout, and you got the little white knight kid going, "Mom, I'm just going to do up these dishes and I'm going to make the beds and I'll come down and see if you need any more help." And in doing that, they're making their sibling look terrible. Mm-hmm. And the way you can smoke out a white knight is by disciplining the white knight. Because they misbehave in their own way. And so when you're looking at your youngest and your oldest, and your youngest is goading the oldest, well, sometimes the oldest has to pay a ticket for that. But sometimes the youngest probably would have to pay. It just wouldn't be as obvious what they did wrong, but that doesn't matter. It doesn't have to be really clear. On some level, they know what they're doing.
Right. Right, and the occurrence is notable by the reaction of the oldest, regardless of whether the initial provocation was observed or not.
I think at the age of 9, it's probably too soon to educate the 9-year-old about the fact that their reaction is reinforcing the very thing they're upset about.
Yes, I've thought about that as well.
Just a little young for that insight. And even when they're like adults, it'll still be hard to grasp. Sometimes the way we react to people is a reinforcer for what they did in the first place, but we keep doing it anyway because the provocation is so intense. But for a 9-year-old, I don't know if they'd be able to grasp that or not. Another way I discipline everybody.
Yeah. Okay.
It's barracks justice.
Yes. All right. Well, I'm going to kind of move this conversation a little bit away from home.
Sorry about that.
It's okay. It's with me, not you. It's so no, that's good stuff to consider. So I appreciate it. And what my larger hope is that this is instructive to people who are listening. So I guess
Sure.
I'm kind of being sacrificing myself for the good of others, or exposing myself rather. But anyway, moving right along. Do you see that the problem behaviors are evolving? Sometimes there's the tendency for, an older generation, to say, well, these kids these days, and I'm, now, securely in my 40s, so I guess I've got license to start using, those types of terms, or do you see the same that, you've been doing this for a while? Do you see things changing with either the aspects of technology, or I think one of the things that you've talked about in the past is kind of like the child first mentality and so forth. How do you see things moving, or do you see things moving, or are they more universal in nature in terms of the types of challenging behaviors parents face?
Well, one of the things that's universal is kids today. Like, kids today has been going on since there were kids and today.
Mm-hmm.
I mean, every generation since the dawn of time has done kids today. That's not going to stop, because the kids today are responding to the contingencies of their world, which is different than the contingencies of their parents' world. And so the parents inevitably interpret what the kids today are doing as a problem, because it's not what they did or what they would do. So the kids today, these kids today, that's always going to be there with every generation. Now the question is, are there certain things that kids today are doing that are unique problems? And there's no question that's the case. The whole social media is something that no kids of any day have ever had to deal with like they have to now. And I really feel like kids today are going to come up a little short in what I might call face-to-face communication skills, because they're so reliant on their instruments to communicate with each other that they don't get much practice actually having conversations. And I make fun of some of the teenage boys that I work with by saying something like, look, buddy, if I was your age, I'd steal your girlfriend. It'd be no problem. And he's like, well, yeah, how'd you do that? I go, well, I'll tell you how I'd do it. I'd talk to her. So she and I would be talking, and she'd go, what is this? And I'd go, well, this is a conversation. Yeah, my parents taught me how to do it. How do you like it? And she'd say, I like it a lot. And then before long, buddy, you know what? We'd be talking about you. And pretty soon, she'd be my girlfriend. And what I'm just trying to get across to the kid is, don't try and conduct your relationship with your girlfriend using your cell phone. Get over there and show her your face, show her your emotions, show her how you express yourself, including all your oddities, all your idiosyncrasies, all your eccentricities, all your shyness, all your shuffling feet, and let her see you as a human being. And that kind of power will be very attractive to her, and far more attractive than the sentences of text that she gets from other boys. But I don't think that's going to play out. I think that the people that are designing the technology are so incredibly good at it, and the products they're developing are so powerful that they're really going to outstrip the capacity of human beings to manage that stuff. And I feel like voice-to-voice and face-to-face conversations are not going to be a dying art, but they'll be a diminishing skill set. And maybe as a result, a kind of impoverished set of relationships that these kids have in their lives. So I don't know that it's going to be true, but that's the way things look to me.
I see.
I see teenagers having arguments with each other where they're in the same room, using their cell phones rather than actually talking. So how are they supposed to learn the give and the take of a disagreement when you're face-to-face with somebody, when they're relying on their cell phone and they can keep their emotions under better check when they're just typing? So I don't like the direction of that.
Yeah, and certainly as adults, sometimes we're not always the best models of that either.
No kidding.
I have I've seen people, argue with their spouses via text, and it's just like,
well,
nothing good could come of that.
I do a lot of marriage counseling. In fact, increasingly, that's most of what I do. And I have to admonish the couples that I work with to not ever have significant exchanges via text, because neither of them is Shakespeare. So they're not getting their true feelings across very well. They're not getting their true intentions across very well, because it's very hard to capture your true feelings and your true intentions with the written word. It takes an exceptional writer to do that. And they're dashing off these texts without even thinking about them, and they land badly, and off they go to the races, not because there's a fundamental disagreement between them, but because of the way they communicated, a small disagreement. I think the cell phone for them should just be about who, what, where, and when.
Right. And what I see too is that then you have, the permanent product of the exchange, and that's that kind of permits people to kind of relive the experience as well, and that doesn't obviously help matters.
They bring it in and show it to me.
Yeah. Oh yeah.
You believe what he texted? I'm like, why are you guys having this exchange on text? Well, anyway, like the point I was making is, the permanent product is a problem.
Indeed.
The phone doesn't forget.
Wow. Well, Pat, I'm looking at the clock now, and I'm just realized we've covered your induction into psychology, an overview of Boys Town, parenting, my parenting in particular, and now we're on to marriage counseling. So I'm thinking that, like, if we had more time, we could probably continue talking about a variety of different topics. But I think for the at least the purposes of this episode of the podcast, it might be an appropriate time to bring this to a close. It's been a fascinating conversation. Do you have any last thoughts, or pieces of advice, particularly, thinking that the audience is probably, it's probably a behavior analyst on her way to work, driving through, on her way to a clinic or a school or a home or what have you, so any parting shots, if you will, to our listeners?
I have a parting shot for all behavior analysts.
Sure.
Because I really don't think behavior analysts realize what they've got. Because what we have is central to our field, central to our worldview, is the most powerful idea ever invented by mankind for understanding, knowing, and approaching human behavior, especially when it's a problem. That is that behavior is a function of circumstances. And that idea is in competition with really old ideas that are damaging to human relations, such as behavior is a function of problematic morality, or behavior is a function of problematic character, or behavior is a function of problematic psyche. And those are actually dangerous ideas that are kind of central to all the horrible things that humans do to humans. Once you take that circumstantial view, everything improves. And everything that idea has touched, from the human warehouses that are now emptied out all the way up to what we've done with the autism spectrum, has improved tremendously. I just think it's important for behavior analysts to kind of appreciate the power of the idea that's central to their professional and personal lives. So I'd leave them with that.
All right, great. Well, Pat, thanks so much for joining us. I really appreciate the time you took out this morning to have this chat. It's been a lot of fun.
Yeah, you bet. Thanks a lot, Matt.
All right, thank you. What a great piece of advice to end on, and I hope you enjoyed that episode as much as I did. If you did enjoy it, I would really appreciate it if you took a few minutes to head on over to iTunes and leave a rating and review. It just takes a couple of minutes, and it really helps make this podcast stand out amongst the zillions of podcasts that are out there. So, again, I would appreciate that very, very much. And stay tuned for part 2 of my discussion with Pat Friman, where we kind of expand on a lot of the topics that we brought up during this conversation. But until the next time, thanks for listening to the Behavioral Observations podcast, and we'll see you later.
Thank you for listening to the Behavioral Observations podcast with Matt Sikoria. You can find Matt's notes on this episode at www.behavioralobservations.com. We also invite you to stay connected with us on Facebook at facebook.com/behavioral observations and on Twitter at Behavior Podcast.